Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, welcome to a new lecture today. I would like to deal about one of the most important topic in gynecology and obstetrics, which is called as multi-fetal pregnancy. So, in the multi-fetal pregnancy, the most important one in multi-fetal pregnancy is twin pregnancy, right? So, if you see the twin pregnancy, it is the most common multi-fetal pregnancy. If you see, there can be monozygotic twins, or there can be with they have originated from the same zygote, or there can be dizygotic twins which have originated from two different zygotes. It can be in any way. So if monozygotic, so this is monozygotic twins, this is dizygotic twins, right? If it's monozygotic twins, they are mostly identical. If it's dizygotic twins, they are not identical. Monozygotic twins, they are identical, they are not identical, and the genotype is similar, the genotype is not similar. Genotype is similar in monozygotic twins, it is different in dizygotic twins. If you see the gender, is it male or female, the gender is similar in monozygotic twins, it is not similar in dizygotic twins. So first let us learn the risk factors of dizygotic twins. So dizygotic twins, here these risk factors. The risk factors of dizygotic twins include, so the major risk factors of dizygotic twins include: one, increasing FSH. In the risk factors, it can be due to increasing FSH, any reason which can increase FSH, like maternal age. It can be due to maternal age can increase FSH, or it can be multiparity, even multiparity can increase FSH, or it can be because of some race. Okay, anything which whenever anything which increases FSH, whenever there is increase in FSH, this will lead to dizygotic twins. And then sometimes whenever there is a history of dizygotic twins in the family, even then there is a chance of having dizygotic twins. Or if the woman has undergone ovulation induction, in the ovulation induction she used either clomiphene citrate or gonadotropins for ovulation induction, even then there is a chance of having dizygotic twins. Now so this is about dizygotic twins. Now let us learn about the monozygotic twins. So what are we going to learn in the monozygotic twins? If you see the monozygotic twins, now let us learn about the monozygotic twins. One of the important thing which I would like to discuss about monozygotic twins. Here, one, the monozygotic twins can be divided into diamniotic dichorionic twins, diamniotic and dichorionic twins. If there is diamniotic and dichorionic twins, then the timing of fertilization is less than 72 hours. If it is diamniotic and monochorionic twins, then the for time of fertilization, that should be 4 to 6 hours. Or it can be monochorionic and monoamniotic and monochorionic twins. In such stages, the time of fertilization is 8 to 12 hours. And then it can be conjoined twins. If it is conjoined twins, then it is more than 12 hours. So based on it, first, if it is diamniotic and dichorionic twins, then it is less than 72 hours. If it is diamniotic, monochorionic, it is 4 to 6 hours. Monoamniotic, monochorionic, it is 8 to 12 hours. Conjoined, more than 12 hours. So this is one thing which is important. Now here, if you see in the dichorionicity, if there is dichorionicity, how are you going to differentiate in transvaginal ultrasound? See, you were given a picture of transvaginal ultrasonography. With the help of transvaginal ultrasonography, how are you differentiate? How are you going to differentiate it as monochorionic or dichorionic twins? Okay, with ultrasonography you can differentiate as monochorionic and dichorionic twins, because in the first trimester itself, if you see, now these monochorionic monochorionic transvaginal ultrasonography helps us to differentiate between monochorionic and dichorionic twins. If you see monochorionic twins, there is only one chorion. In the dichorionic twins, there is, it's like the whole both the zygotes, they are surrounded by only one chorion, that is monochorionic twins. In dichorionic twins, both the zygotes have their own chorion, so this is dizygotic twins, right? So in dichorionic twins, right? Monochorionic twins and dichorionic twins. Now in the monochorionic twins, if you see they have one gestational sac, whereas in dichorionic twins it has two gestational sacs. Next, in monochorionic twins, if you see the dividing membrane which is there, that is thin. Why? Because there is nothing, there is only a small thin membrane. So this dividing membrane which is there, it is thin in monochorionic twins. In dichorionic twins, there are more than two layers which is seen, because amnion will also be there. So the dividing membrane which is there, that is thick in dichorionic twins. Okay. So if you see in monochorionic twins, the placenta which is there, so the placenta which is attaching the two twins, this is only one placenta. In dichorionic twins, it has two placenta. Okay, in monochorionic twins, the placenta which is attached to the uterus, so this placenta which is there, that is only one placenta in monochorionic twins. In dichorionic twins, there are two placenta. Okay, the dividing membrane which is there, that is in the monochorionic twins, the dividing membranes are two layers. In dichorionic twins, there are 3 to 4 layers, because here there will be amnion, chorion and then amnion. There will be only two amnions here. That is the only dividing membrane. Here there will be amnion, chorion also. Okay. So here the dividing membrane is 2 layers. Here the dividing membrane is 3 to 4 layers. Okay. Then in monochorionic twins, if you see, there is a sign which is called as T sign. Okay. Why is there a T sign? If you see the placenta which is there in monochorionic twins, here there is no dividing membrane, right? So as a result, the placenta which is there, that will appear as a sign of T. There is no extension of placental tissue between the layers of dividing membrane. See, it is like this and it is coming like this. So this is T sign. Okay. In the dichorionic twins, there is a sign which is called as Lambda sign. So what are you going to see in the Lambda sign? In the Lambda sign, see, if you see, there is tissues between the two embryos, and as a result, the placenta which is there, that placenta will have a triangular projection and it divides into two. So this sign which is there here, this is Lambda sign. Okay, so these are the both important signs which are seen in mono and dichorionic twins. Once a mother has monochorionic twins or dichorionic twins, first you will have to know about the history of twins. Take the history of the mother. So in the history of the mother, you'll have to look about the advanced maternal age or high parity, or history of ovulation induction, clomiphene citrate, gonadotropins, and you should also think about the assisted reproductive therapy which you have to give, which she has undergone. For pregnancy, she must have undergone some assisted reproductive technologies. You should take history about it. You should take history about the family history of the twins, and then does the parents have one of the twins? Even that should be taken into account. Past history of twins should be taken into account. Next, symptoms. In the symptoms, we will learn about symptoms now. I'll just take a new page. Yeah. Next, in the symptoms, now we have symptoms. So if you see in the symptoms, we have symptoms in first trimester and second trimester. If you see here, there are two babies in the uterus. Because there are two babies in the uterus, obviously the symptoms, all the symptoms will be more, because there are two babies, there is increased beta HCG. Because there is increased beta HCG, this will lead to hyperemesis, that is increased vomiting, which can cause hyperemesis gravidarum, and so that is the major symptom which is seen in first trimester. Okay. Next, if you see in the second trimester, then if you see in the second trimester, mostly the uterus which has been there, that has come to the abdomen, right? The uterus has now come to the abdomen. As the uterus has now come to the abdomen, so the babies which are there, they are growing. Okay, and now there are these because the baby is now growing, the uterus size becomes more, and this is the diaphragm. So let me draw it again. So this is the uterus. Okay, and now this is the diaphragm. Okay, now the uterus which is there, this uterus is now exerting pressure over the diaphragm. Okay, because it is exerting pressure over the diaphragm, this will lead to a symptom which is called as breathlessness. Okay, and it can also, this uterus which is there, back behind the uterus there is a spine. Behind the uterus there is a spine. Okay, and also because of this spine, it will cause, whenever it compresses the spine now, because it is compressing the spine backwards, this will cause a symptom of backache. Okay, and then this uterus also pushes all the intestinal things which are there, all the intestines to the sides, into the flanks, or it will compress the intestines. Because it will compress the intestines, it also has GI symptoms. So these are the different symptoms which are seen in twin pregnancy. Okay, now we'll have to do the physical examination. Once we have done the physical examination, we will have to, in the physical examination, you will have to first see about anemia, because there is twin pregnancy, so there is a chance of having anemia in these pregnancies, and there can be pedal edema also, because there is increased the blood volume increases a lot, even more than the normal pregnancy in twin pregnancy. As a result, there is a chance of pedal edema. And then if you see, the patient also has higher blood pressure, there is a chance of having high BP. So these are the normal general parts which you see. And on obstetric examination, if you do the obstetric examination, in such cases you will find that there is a the uterus which is there, this uterus is more than the expected date of delivery. Expected size, it will be more than the expected size, because it is harboring now two babies. Okay, it is now carrying two babies. As a result, the uterus size is more than the period of gestation, and the height of the uterus is more than the expected. Now if you, on palpation, you will see presence of multiple fetal parts, and you will see presence of two heartbeats, and then you will also see a chance of malpresentations. So these are the different things which you see on palpation. Now once you have palpated the baby, now you will send the mother for ultrasound examination. In the ultrasonography, you must have diagnosed the twins. Diagnosis of twins is confirmed by ultrasound, by presence of the fetal parts, and also the lambda sign and T sign which I have shown. Even it will measure the cervical length, which is really important, and it will also, ultrasound also helps to determine chorionicity or amnionicity. It helps to determine chorionicity or amnionicity. So these are the different uses of ultrasonography. Now what are the complications of twin pregnancy? So we'll learn about the complications of twin pregnancy in our next class. Thank you guys for watching my lecture. Thank you.
Thank you, and thank you for watching.